First on 4, federal funding has expired for the Children's Health Insurance Program, and Congress hasn't shown signs of progression for renewal of funds. CBS 4 Stephen Seeley spoke to a local doctor on how his patients will be impacted if CHIP falls through.
The Children's Health Insurance Program has been providing low-cost health coverage for families that earn too much to pay for Medicaid and can't afford private health insurance. Since 1997, both the state and federal government have funded the joint program.
Say when you compare 1996, there was about 15% of children in the U.S. that had some form of health insurance. Now with that and some with the Affordable Care Act as well, that number is up to over 90%.
Now, over 9 million children receive coverage through CHIP. Dr. David Salceda owns the Valley Children's Clinic in Harlingen. He says the Rio Grande Valley in general has a higher number of children who are insured under CHIP than most of the state.
About 80%. About 80% is probably a little lower ballpark figure of how much of our patient population is on either Medicaid or CHIP.
According to the Georgetown Center for Children and Families, at 9%, the state of Texas has the highest rate of uninsured children.
Basically, Texas has enough money to get us through around February, and after that, we're in trouble.
The trouble Representative Terry Canales is alluding to is children losing coverage over everything from dental care, prescriptions, eye care, and hospital care. Canales believes the delay is being used so the Republicans can negotiate the Affordable Care Act.
This isn't something that we mess around with or play around with. These are Americans, and this is something that they've come to depend on. And I believe that this is something that shouldn't be used in the manner in which it's being used.
Congressman Vicente Gonzalez and 80 other members of Congress signed a letter for Speaker of the House Paul Ryan asking for the reauthorization of funding for CHIP. In the letter, it reads, "As you continue to work to reauthorize and extend provisions included in the Medicare Access and CHIP Reauthorization Act, Congress must continue CHIP's legacy of providing care for children and pregnant women in low-income families by extending the program immediately. This should be accomplished without resorting to poison pill offsets. We thank you for your continued commitment to our nation's children and urge you to bring CHIP extension legislation at full funding levels to the floor as soon as possible." In Harlingen, Stephen Seeley, CBS 4 Valley at 6.
Representative Canales believes that the delay won't last long, but the uncertainty does help those who could go without coverage.